Hi everyone. I am doing my head and neck assessment. So, hi, my name is Taneeya, Mrs. Dandridge. I'm your nurse this morning, and the doctor has asked me to do a head and neck assessment for you. Is that okay? So, Mrs. Dandridge said it's okay. So, the first thing we're going to do, we're going to close the door and give her privacy. So, I'm going to shut the door and the curtains. Okay. I'm going to identify Mrs. Dandridge. Is your name Jayla Dandridge? Yes. Were you born December 27, 1942? Yes. So now that she has identified herself, the next step I'm going to gather my supplies. I'm going to wash my hand and put on gloves. So now we are washing our hands. I am finished. I'm going to put my gloves on. So before I even start, I'm going to ask her a few questions. Good morning, Mrs. Dandridge. How are you? Good morning, Jayla. That's what I'm going to say. I'm fine, and yourself? So I want to explain that I'm going to do, the first thing I'm going to start with is your head. But I have a few questions before I even start. I'm going to put Mrs. Dandridge in an upright position. She's already sitting. And I'm going to raise the bed to the level where I can assess Miss Jayla. And I'm going to let the rail down. So you see she's in an up sitting supine position. The bed is let high waist. I'm going to release the rails. So Mrs. Dandridge, so do you smoke? No. Do you have any issues with your neck and your head? Oh, no. Well, that's good, Miss Dandridge. So I'm going to explain to you that I'm going to be doing. The first thing I'm going to do, I'm going to look at the contour of your head. So I asked Miss Jayla a few questions before I even start. The first one I asked her, have she smoked? She said no. And the second one, has she have any pains in her neck and her head? And she said no, which is good. Because if she did, I would have had to investigate it a little more. Why? What is causing the pain? When did the pain start? Or, the tenderness. So the next step I'm going to do, I'm going to check for the contour of Jayla's head. Okay. I am checking the contour. Everything is fine. So I checked Mrs. Jayla's head, which is the contour. So everything is symmetrical, meaning everything is fine, everything is in shape. So the next step that I'm going to do the hair, and I'm going to explain to Jayla. So Jayla, how are you? Are you comfortable with me checking your hair and your scalp? Yes. So the first thing I like to do, I like to make sure that my patients are comfortable with me. So I asked Jayla, is it okay if she's comfortable with me checking her hair and her scalp? And she said yes. So I'm going to proceed the assessment. Okay, I am checking Jayla's hair. She has straight hair, full hair. And it is a little thin in the back. Okay. She has no lesions, no bumps, no lumps or scars, and I'm checking for infestation of any lice or anything. So as you see, I have checked Jayla's hair. The first thing I wanted to notice, I noticed that her hair is very thin in the back. She has straight hair. It's full in the front, but it's a little thin in the back. I'm going to ask a few questions about that. And I checked for any bruises, lesions. She has none. And I also checked for infestation of anything, lice, ticks, whatever. She does not have. So the next step, Mrs. Jayla, how are you feeling? You're okay. 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 So the next step, so Mrs. Dandridge, how are you feeling? Are you comfortable? So I'm going to explain to you your neck. Are you able to lift your neck? She said yes. So I had to take the gloves. I'm going to wash my hands because I had to do palpate. Palpate means where you check for tenderness, any warmness, any coldness on the patient. But I'm going to wash my hands. I'm going to throw the gloves away. Wash my hands. And I'm going to explain to Jayla the next step, what I'm going to do after the head assessment. So Jayla, are you comfortable with me doing the neck assessment? Yes. Okay. So I'm going to check for any deformities, any lumps, and tenderness. So I proceed to ask her questions about the tenderness. Okay. So I'm neck. Okay. So I check Mrs. Jayla's neck. I look for a palpate, meaning I will check for any tenderness, any pain, which is good that she does not have. So the next step I'm going to do, Miss Jayla, I want to feel for your pulse and your temporal, okay, and the metabar, metabar. Compare, okay, and the bilateral, okay. So the next, I just got through checking the bilateral and the metabar for Mrs. Dangerous, and so far she has no tenderness, which is a good thing because if she did, now I have to further investigate the tenderness. She's warm, nice temperature, everything symmetrical is fine. So the next thing I'm going to do, the next step, I'm going to palpate the glances and look into the mouth. Can you open your mouth for me so I can check Mrs. Dandridge for any clicking? Okay, thank you. So now that you're palpating, can you go a little slow? Mouth is normal. No lumps or anything. Okay. So I looked into Miss Jayla's mouth to palpate to check for any lumps, any clicking. If I would have heard the clicking, I would have to further investigate that as well. So far she has none of that. So the next step, I'm going to check her glands. Mrs. Dandridge, are you comfortable with me checking your glands, your throat? Okay. So can you open and close for me? Okay. So I'm going to palpate the trachea. Okay, ground slow. So I feel no bumps. So can you breathe a little slow? Okay, thank you. So that was our last complete step. So I had to do the trachea, which is palpate. So I had to feel for any glances for Miss Jayla. Her glands are normal. Everything symmetrical is fine. I asked her to breathe a little slow. I saw no coughing, no gumps or anything. So for this assessment, she is okay, but I do have to report, document about the thin hair and the dry scalp. That's it. Y'all have a blessed day. Future nursing in the making.